Welcome to day 2 of Smart Beginnings 2024, Early Beginnings to Bright Futures. I'm pleased to be with you today as we continue our journey toward enhancing the developmental and educational outcomes for our children with disabilities. The virtual mini-conference, Smart Beginnings, is designed to provide families, educators, service providers, and leaders with the tools and knowledge needed to support the growth and success of infants, toddlers, children, and youth with disabilities, and of course, to support the families. Smart Beginnings emphasizes the importance of laying a strong foundation from the very start. Over these 3 days, we're exploring strategies to improve academic and developmental outcomes, deepen family engagement, and advance equitable access to high-quality early intervention and education through evidence-based practices. Today, our focus is on the vital role of parents and families in this journey. Today's sessions will cover key topics that are essential for families and caregivers. We'll explore the importance of inclusion and practical strategies for ensuring your child's full participation in all aspects of life, school, community, and beyond. Every child has the right to be included, and we'll discuss how you can work with the schools and communities to make inclusion a reality for our children. We'll also delve into the importance of engaging multilingual families. Language should be a bridge, not a barrier to accessing appropriate services and supports. It is crucial that all families, no matter what the language they speak, feel fully informed, empowered, and connected. Our sessions will offer insights into how schools can better communicate with multilingual families and ensure that language differences do not hinder your involvement in your child's education. In addition, we'll focus on building family capacity to partner with schools. Collaboration between families and schools is key to a successful experience for children with disabilities. Whether it's understanding your rights, effectively participating in IEP meetings, or advocating for your child's needs. Today's discussions will equip you with the tools and confidence to be a strong, informed partner in your child's educational journey. I'm also excited to share that in addition to today's live stream sessions, we have prepared additional video presentations that provide a deeper dive into the specific needs and experiences of the populations we're focusing on today. These on-demand videos offer valuable insights and resources tailored to different groups within our community and ensuring that you have access to the important information that matters the most to you. Throughout the day, you'll hear from OSEP leaders, subject matter experts, and fellow parents who will share practical, action-oriented strategies and resources. I encourage you to take full advantage of the opportunity to ask questions, share your experience, and learn from one another. Your voices are powerful, and your experiences are invaluable to shaping the future of special education. Thank you for joining us today and for your unwavering commitment to your children. Together, we can build stronger partnerships, more inclusive communities, and brighter futures for all of our children. So let's make this day count.
Welcome to this session of the 2024 Smart Beginnings Conference. So today we're going to talk about building the capacity of families to participate in database discussions. And we're going to start with introductions. So my name is Michelle Lewis. I am the Executive Director of the Parent Information Center in New Hampshire, and I'm also a consultant on the Center for the Individuals with Disabilities Education Act Early Childhood Data Systems, affectionately known as DAISY. So I work on that project, providing some family perspectives and working to increase family engagement in that center and across the states. So I'd like to introduce you to my co-presenters. First up, Deepa.
Thank you, Michelle, and welcome again, everyone. My name is Deepa Srinivasa Varadhan. I'm the Director of Early Childhood Initiatives at SPAM Parent Advocacy Network, which is the Parent Center in New Jersey.
Hi, I'm Cindy Weber. I'm an early childhood trainer and TA specialist for SPAN Parent Advocacy Network. That's New Jersey's Parent Training and Information Center. I'm also here as a graduate of the Family Data Leaders Program, and I'm here to tell you a little bit about my experience.
First up, we're going to talk a little bit about what the Family Data Leader Training is. So this training was developed by the Center for Parent Information and Resources, affectionately known as the CIPR. And the CIPR is the hub for information and products for parent centers that serve families of children with disabilities, such as SPAN, and I'm the New Hampshire Parent Information Center. So that's our hub, our base for getting information. The second is the Center for IDEA, that Individuals with Disabilities Education Act, Early Childhood Data Systems, in which I'm a consultant on, but that's a national technical assistance center that is really helping support Part C, or early intervention, and Part B 619, which is preschool special education, state programs in building those high quality data systems and using data to improve results for young children with disabilities and their families. So, as I said, this is a collaboration between the CIPR and DAISY Center. And so what is this Family Data Leader Training? So it's a series of sessions on using data to improve programs and systems. And parent centers are the recipients of this Train the Trainer to recruit, train, and provide the training and ongoing support to the families that participate in this training. So it's a very unique opportunity in terms of helping families and other stakeholders, if they choose to participate, learn more about data and how to participate in database discussions. The goal of the Family Data Leader Training is to build capacity of families to participate in data discussions. And so you may be thinking, what the heck does that mean? And I guess the piece that I would say is, I remember when I first came into the system and I saw lots of data coming at me as both a family member, as well as looking at kind of, on my own child, as well as looking at it from the systems level. And I didn't know what to do with the data. And so this is really an opportunity to build capacity, so help families understand more about data and how to participate in those data discussions so that they are able to contribute, or we are able to contribute as family members on program improvement and systems level data. So let's talk about the data training itself, the Family Data Leader Training. The way it was originally put together was envisioned to be 4 sessions, and we're going to walk through the sessions, but parent centers can actually break it into more sessions, and you'll hear more about that in a minute, or they could do less, they could do an all day, but we do have it split up into 4 sessions that would include these topics. And I'm going to highlight a couple from each of the sessions. For session 1, it's really looking at what does it mean to be a family data leader. We spend some time looking at Part C, or early intervention, or preschool special education, which is Part B 619. We also take a look at and discuss systems change, engagement, and taking a look at the relationship between data and accountability. Session 2 is almost exclusively focused on data. Everything you wanted to know about data, but were afraid to ask, or didn't know you even needed to ask. So looking at the stages of the data cycle, all about the state performance plan, annual performance report, affectionately known as SPP APR, and then using data to advance equity. And then looking at different ways to successfully participate in effective communication. Moving on to sessions 3 and 4. For sessions 3, the focus is on all about and how to use something called look, think, act. And that is a strategy for using, analyzing, and planning next steps related to data that can be applied to the systems level, the individual level, the program level. And the 4th session is all about applying those learning to data scenarios and practicing and gaining more strategies for family data leaders to be successful during data discussions. As we look at the family data leaders learning objectives, I know there's a lot of words on the screen, so I'm going to highlight a couple of them. One of the objectives is to really understand the role of a family data leader, the importance of family voice, and emphasizing ways families can participate in database decisions, both at the local, state, and the national level. Another aspect for what we're hoping families would gain during this training would be understanding why data is critical to inform program improvement and systems change. The third piece is understanding and applying knowledge of the basics of data, data analysis, and data use to Part C, early intervention, and Part B, 619, preschool special education programs. And finally, exploring and beginning to apply look, think, act, which is that data use framework, to engage with data, to play with data, to really strategically look at data for program improvement and for increasing child outcomes. So what does it mean to be a family data leader? Families are critical to any discussion, but particularly for data discussions, because families bring the family perspective, the community experience, and lived experience to inform systems change efforts. And that's really critical. We provide a very unique perspective, and we can look at it through these very different lenses. So why is it important that families are involved in data discussions? So in addition to bringing that lived experience, families have unique life stories on behalf of all children and families, not their own. So we all live in a community, and we can bring all of what we're hearing from the community to these database discussions. Families bring different levels of access to information and support, so that's really important for our state counterparts to know and make sure that we're explaining the information and kind of making sure we're not speaking in acronyms without explaining what those acronyms are. Also, families bring different personal and professional experiences with data. So we may have a job that we're very involved with data. We may be very involved with data for many, many different reasons, or we don't have a relationship with data at all. So we need to keep that in mind in terms of how we approach working together. And then families bring intersectional identities that inform their understanding of data. So when we think about intersectional identities, that is how people with overlapping identities experience systems. So it's really looking at if you are a female and you're also an Asian American, those overlapping identities inform your understanding of the data. So it's not an either or, and so that's an important piece to keep in mind as well. Families also bring varied feelings about today's data-rich culture. And this is important for us to think about because we're constantly bombarded with data if you watch the news. And at different points, data hasn't been used to move all groups forward. There's pieces we need to think about People can be very wary of data, not believing the data or what they're seeing. And sometimes it's been used to hurt other people. And so families bring different perspectives. And the last piece is that families bring diverse voices to the table. In terms of who is participating, when it comes to the Family Data Leader Training, we talked about the Center for Parent Information and Resources, as well as the DAISY Center. There's an activity team where there are joint staff collaborating to develop this training. And we piloted the training with 14 parent centers from 13 states. And it involved an application process. And those parent center pilot participants were so critical in making refinement to the training after they had delivered the training to parents in their communities. And right now we've brought on cohort 2, which are 9 parent centers, which are 7 additional states. So we're really excited that we're in 20 states across 23 different parent centers. So I'm going to turn it over to Deepa.
Thank you, Michelle. So we just heard about the importance for families to be involved in database discussions. Now we're going to talk a little bit about what parent centers are, why is it important for parents to be connected to parent centers, and how you can do that. So a parent training and information center is a terrific information resource for parents of children with disabilities. Every state has at least one PTI, and each one has a different name. So in New Jersey, we call it the SPAN Parent Advocacy Network. In Pennsylvania, they call it the Parent Education and Advocacy Leadership Center. So you can see there are different names, but basically they're all known as the Parent Training and Information Center, and every state has one of those. Some states also have a Community Parent Resource Center, and there may be more than one in each, in some of the states. So CPRCs do the same work as the PTIs, but their focus is on reaching underserved populations of children with disabilities, such as those living in a specific area in the state, those with low income, or those with limited English proficiency. The PTIs also have this responsibility, but the CPRCs have a very intentional focus on this. The PTIs and CPRCs are funded through our nation's special education law, and which is called the Individuals with Disabilities Education Act. Their purpose is to provide parents with information and training about disabilities, parent and children's rights under the IDEA and other relevant laws, and resources in the community, state, and nation. One other thing to remember about parent centers is that most of them employ parents or individuals with lived experiences. So they have this component of peer-to-peer support, along with training and education for families. So in addition to that, they continuously focus on helping families to build their capacity to participate as equal partners in decision-making. And their goal is also to elevate family voices and perspectives by empowering parents. So that's the role of the parent centers. Now we'll take a look at an example of a parent center, which is the SPAN Parent Advocacy Network in New Jersey. We in New Jersey are focused on empowering and supporting families and to inform and involve professionals who are interested in the healthy development and education of children and youth. And our foremost commitment is to children and families with the greatest need, and that could be based on disability or special health or mental health needs, poverty, discrimination based on race, ethnicity, gender, language, immigrant, or homeless status. It could also be based on involvement in the child welfare or juvenile justice systems based on geographic location or other special circumstances. We assist families to access services, increase their knowledge, connect with other families, help them understand their child's development and advocate for their needs. We help them to communicate more effectively, and we also help them build their leadership capacity to be able to participate in decision making. So, as one of the parent centers that participated in the initial pilot of the Family Data Leaders Project, we completed the implementation in 2023. We received excellent support from the DAISY and SIPR team, of which Michelle is one of the team members. And then what we did with the training itself is we took the 4 sessions and converted them into 8 one-hour sessions, because we thought that it would be helpful for families to receive information in smaller chunks so they can process the information and be able to apply the content and the principles more effectively. So when we piloted this, we had 12 participants join our sessions, and 8 of them completed the full training, meaning 8 of them were able to participate in all of our 8 sessions. And participants comprised of SPAN parent leaders and SPAN staff. And we also had support from our Part C, which is early intervention in New Jersey, and Part B, 619 preschool special education staff, come and share information with participants. So they were in the loop right from when they started to get trained about all these systems and what opportunities existed for them to participate. So now I'm going to turn it over to Cindy Weber, who is a parent leader and also a SPAN staff, so she can share her experience about participating in the Family Data Leaders training.
Thank you, Deepa. As parents, we have this unique knowledge, the power of our personal stories and of our experience. Far too often, we don't know the value of it, where to tell it, or who to tell it to. It can be very difficult to navigate these systems and the roles of the people that are supporting families. Taking Family Data Leaders helps decode those systems that we use from infants into early childhood and beyond. The program breaks down common language, acronyms, and explains it in order to build understanding so that parents can participate in these discussions in stakeholder meetings as equal partners. It leaves participants with how they can build up other families in their community, so the work is always continuing. Using data to support our personal stories or the stories of others can be an excellent tool to support change. As a SPAN staff member, Family Data Leaders enhanced even my knowledge of data and early childhood systems, and I continue to use that knowledge nearly daily in my work. So thank you so much for inviting me.
Thank you, Cindy, for sharing your experience with us. Now, what can you as parent leaders do in understanding data and being able to participate in database decisions is something that we're going to talk about in our next slide. But here we're going to talk about some of the next steps for the parent leaders who participated in the training in New Jersey. We're continuing to collaborate with our Part C and Part B 619 leadership to build the capacity of parent leaders so they can participate in the State Interagency Coordinating Council, be able to provide feedback on the federal application during the public comment period, and also participate in what's called the State Performance Plan, Annual Performance Report, target setting work groups to improve family and child outcomes. We're also providing invitations to parent leaders who participated in the training to participate in webinars, conferences, and information sessions where they can not only share their experience about participating in the Family Data Leader training, but how they are applying all of that information and what outcomes they've been able to contribute to. So we're constantly trying to look for opportunities where we can collaborate with them on these presentations. So for your next steps, I would highly encourage you to connect with your parent center today. You can use the link on this slide to connect to your parent center to learn about trainings and other opportunities they offer. Again, as Michelle said, there are some parent centers across the state that are participating in this Family Data Leader project. Your parent center could be one of those. Or even if they're not a part of this project, they may have other opportunities that you can make use of, that you can participate in and enhance your skills for understanding data. And then they may also be able to help you connect to opportunities, whether it's within the Part C or the Part B 619 system, to participate as an equal partner in teams and groups that make decisions based on data. As your next step, again, please make sure you connect with your parent center. You have a lot of opportunities that are out there that you may not be aware of. I can certainly say that I was one of those parents who did not have access to those opportunities. And by contacting my parent center, I was not only able to support my own child and help my child, but also participate in making improvements to the early childhood system and be able to participate and support many other early childhood projects. And I know Cindy's story is the same too. I hope you'll make use of this opportunity to connect with your parent center today. And please let us know if you have any questions. We're happy to answer those. We also have our contact information on the next slide. Please feel free to reach out to us with any questions. Thank you.
Hello, and welcome to the WestEd presentation on behalf of the Collective Impact Model for IDEA Part C Child Find presentation for the 2024 Smart Beginnings Conference. We are super excited to have you join us for a short discussion on engaging families. What is early intervention? My name is Leslie Fox. I am the project director for this project funded by the Office of Special Education Programs. I am super excited to be sharing some of what we've learned about engaging families and understanding the purpose of early intervention so that families are appropriately referred as timely as possible and to ensure access to services as quickly as possible based on their needs, but based on really the understanding of referring providers to explain early intervention and communicate what we do so that families know what to expect once a referral is made. I have worked in early intervention since 1994, when it was actually Part H at the time and then became Part C. I was a service provider working directly with children and families in home and community settings for the better part of 18 years. I worked on U.S. military bases, serving military families in Italy and Spain. And I've worked in Texas, and then I've supervised pre-service early intervention providers who were pursuing education degrees at the University of North Carolina at Chapel Hill. I worked at the Office of Special Education Programs at the U.S. Department of Education, doing monitoring and technical assistance with Part C lead agencies. And now I work for WestEd, where I just love the fact that I get to continue my connection supporting infants and toddlers with developmental delays and disabilities and their families through technical assistance projects like this one. I'm going to pass this over to my colleague, Jamie, who will tell you a little bit about herself.
Hi, everyone. My name is Jamie Michaud, and I've worked in a variety of roles in the early childhood special education field for the past 20 years. I found my way specifically to early intervention in 2011 when my son was born. And since then, I have worked as a service coordinator, an early intervention program manager, and most recently, before joining the team at WestEd, I was the Part C coordinator for the state of Maine. During this presentation, we will provide you with a brief overview of our project, as well as the unique context of our project sites. We are also going to explore how early intervention is described to families, share examples of resources that have been developed, and discuss what we have learned from families along the way. Now let's take a look at our model. The goal of our project is to better identify and serve infants and toddlers and their families who are underserved, hard to reach, or under-referred, and as Leslie mentioned in her introduction, to increase the appropriate referrals to IDEA Part C, or early intervention. Our project consists of 3 main components. The local Child Find Leadership Team, or LCFT, includes a variety of community partners who collaborate to develop a clear definition of early intervention, create a shared vision for their community's screening and referral practices, and contribute to culturally responsive resources for communicating both timely and accurate information to families. The Screening and Referral Cadre, or SRC, is made up of a group of providers that focus on effective ways to explain the screening and referral process to families. Through this component of the project, we have identified the opportunity for referring partners to better explain the screening process, from how and why the screening will be administered to the results and recommendations following the screening. For example, some lessons learned include many medical providers may conduct screenings, but do not take the time to explain the screening process or the next steps to families before they are referred to early intervention. Another lesson includes childcare providers who are not always comfortable with bringing up developmental concerns given their unique relationship with parents. Now, the third component, family engagement, is listed as a separate component, but it is an integral part of all of our project activities. Getting families' perspectives about their experiences, successes, and challenges with being connected to early intervention not only helps inform culturally responsive resources that we are working to develop, but also helps us really identify what we can do better throughout the entire screening and referral process. Now let's take a look at where our project is currently being implemented. Our aim is to help local programs better connect with hard to reach populations, as we've mentioned. So we are intentionally working in rural communities that are traditionally underserved due to geographical considerations. Despite the limited resources that are often available in rural areas, we recognize an overarching strength in these communities where we see programs coming together to support the unique needs of infants and toddlers and their families. At each site, we work alongside a state Part C team, a local Part C team, and non-Part C community partners to really understand the community context. For example, looking at our 4 sites, in southeastern Alabama, our local site includes the county seat and its surrounding 4 counties, as well as a military base where early intervention services are provided through Educational and Developmental Intervention Services, or EDIS. Our Montana site includes a 2-city region and a tribal community. Guam, an island in the Western Pacific Ocean, brings a rich cultural history and diverse heritage influenced by its indigenous Chamorro people to the project. And New Mexico, our 4th and final site, is currently in the exploratory phase with identifying a specific region, but this too will likely include tribal or Native American communities.
Thank you, Jamie. So what is early intervention? When we started this project, our first site has been in southeastern Alabama, and we did some exploratory conversations, first with the Part C providers themselves. We also sent out a series of surveys to physicians. We've sent surveys to programs like Help Me Grow or some of the quality rated childcare programs that are in the state. really kind of exploring what is early intervention? What do they think it is? Who do they refer? Do they administer developmental screenings as part of their routine practice? What goes into the decision making as to when they make a referral for a child or family to the EI program? And what we've really learned is that early intervention has a bit of an identity crisis. People like what we do, but they tend to describe how we do what we do, but they don't understand what makes us different from any other home visiting program that may be out there, whether it's a McKeevy home visiting program, Parents as Teachers, Early Head Start, Help Me Grow home visitors. Early intervention as Part C of the Individuals with Disabilities Education Act is sort of lost in the crowd a bit. So when we ask people, what is early intervention? Give me 2 or 3 words to describe what do we do. A lot of things go into describing how we do what we do. We provide family support. We provide coaching. We work in homes. We're parent supportive. We embed strategies and routines. And all of that's true, but that's not necessarily different than Help Me Grow, Early Head Start, or McKeevy home visiting program. So what is early intervention is really important to never lose sight of, that we are an entitlement service for children who meet our eligibility criteria. We are attached to the civil right known as IDEA. And although it can be important to use family-friendly language, it really is important to distinguish and be distinctive about what we are that's different from these other amazing programs and services that they may also be accessing. So what is early intervention is really an important question from our professional standpoint as we reach out to those who we expect to refer to us. Because the challenge with early intervention when it comes to identification and referral, otherwise known as child find, is that we're really requiring non-Part C folks and programs to understand what we do and explain it to families. So all of our contact information, every referral we receive is contingent on the attitudes, behaviors, and practices of non-Part C or early intervention providers. So that identity crisis is really important to address from the referral perspective, not just from the family perspective of what happens once they engage with us, right? So it's been a really interesting process to dig a little deeper into what are the perceptions and sometimes misconceptions of childcare or home visiting programs, medical providers, and child protective services, really anyone that we would expect to talk with families about our services and help make connections through the referral process. So in response to this, we've identified a few things that none of this will sound particularly revolutionary, but I think it's really important. We've had exploratory conversations at several of our sites. We're in different phases of implementation at each site, but there are certain themes that have come up as needs. And resources developed or are in development in response to these needs. So for example, families and providers have really talked about the importance of knowing not only what to tell families, like, hey, we're making a referral to early intervention, but to have the specifics of what families can expect and when they can expect it. Something as simple as an infographic that explains anyone can refer to early intervention in most states, and families can always self-refer. That it's not a one-time deal. Just because you received a referral or referral was made when your child was 8 months old, maybe you went through the process for eligibility, maybe they weren't eligible. That doesn't mean you can't self-refer or get re-referred if new concerns emerge or if existing concerns persist. So the referral process and who can refer needs to be better explained a lot of the times, because providers at all of these different programs also have turnover, and they also kind of drift back to their old mindsets. So it's really this ongoing need to understand who can refer, not just what to refer or when to refer. There's also a really important thing to explain about when families can expect to be contacted by the EI program. Something as simple as you should get a call within 48 hours or within 7 days from this number that's going to show up on your cell phone. So if you see State of Alabama, or if you see Department of Health and Human Services, or you see Leslie Fox come up on your screen or in your call history, that's the early intervention program. Because most of us don't answer the phone these days if we don't recognize the caller. And sometimes we don't even listen to the voicemail. So it's really important that providers be aware of who will be calling the family and when they should be calling the family. As much as possible, it's helpful for referring providers to get other contact information, an email address. Of course, a written address is really helpful, because if we don't have that, then we don't necessarily know whether or not families are just choosing not to, respond to us, or if the one mechanism we've been given is effective and there are other routes to reach the family. Closing the referral loop forms are really important. A lot of states have taken a rather rigid interpretation of HIPAA. And so once a referral is made, the referring provider doesn't know what happened. And there are examples from states, Kansas is an example, Colorado, North Carolina, that have really kind of a closing the referral loop process. It's very clear. It's succinct. Thank you very much for the referral. We were able to contact the information, contact the family. We will not be able to share any additional information without written permission from the parents or guardians. Or, thank you very much for the referral. The family has declined moving forward with this process. Or, thank you very much for the referral, but we have been unable to contact the family. Please see if you have additional contact information, or if your next point of contact, let them know that they can always reach out to us. Those are very straightforward things, but they really help to foster and build trust between the referring provider and the Part C process. Because if providers don't know what happens, then they don't necessarily value our services or understand that it wasn't just that we dropped the ball or didn't follow up, but really we're not sharing additional information because we don't have permission to do so, or we weren't able to actually reach the family. And so these are important things. Talking points about how we want referring providers like child care providers, child protective services, medical providers, pediatricians and family practice providers, how we want them to explain our services need to be tailored to their role. What I would expect a physician to say to a family might be different than what I might expect a child care provider to say to a family. Not because the program is different, but because their reason for engaging with the parent and child comes from a different stance. So you've got to give language that helps play to their role and their strengths as to why they think a family may want to follow up with an EI referral. For military families, if there is an EDIS program available, and not all states have one, then really a first and foremost question is, where do you live? Do you live within the base or post community, or do you live outside those gates? Because that will determine which early intervention program will serve the family and can really help to help prevent gaps and delays of service because the wrong program is being contacted. Where they live matters if there's an EDIS program on the base or post, and they live on the base or post. But if they live off base or post, it will always be the state that picks up the services and is responsible for implementing IDEA. For the Part C program, it's important to ask military families, when do you PCS, or basically permanent change of station? When are you moving? Because some of our processes related to transition to Part B, preschool 619, or helping to connect with the receiving state's early intervention program need to be initiated a lot earlier than they might through our regular processes for families that stay in the area and aren't as highly mobile. Having local child find referral data, we've developed an Excel document that local EI programs can use to take a look at who's referring, which families are getting referred, when are they getting referred, what zip code do they live in, really helping to tease out who's getting referred and who's not, which providers are making referrals and which ones are not. And even the age of referral, it can give you a lot of information about which referring providers maybe have a wait and see approach versus connecting families as early and as quickly as possible to EI services, and then respecting the family's rights to decide whether or not they want to pursue that. And then really tailoring content of any public awareness and child find materials to local context. The beauty and benefit of rural communities is the people stay there. The turnover in providers may be great, but the local programs that represent EI don't change that much. But a lot of times we'll have providers that have wear multiple hats. So it's important to know that if you have local vendors in your area, it could be the Leslie Fox Easter Seals or the Jamie Michaud Private Clinic who contract with the state EI program. So families don't necessarily know that early intervention from the state EI program is the same as the Leslie Fox service provider. So it's not that they have to know that, but it's really important, because if families don't know who's providing the services, then it's really hard to say they understand their rights, and they are always entitled to understand their rights. So lastly, I'll just go over a few things that we have learned from families. And these may not be particularly revolutionary, but I think it can be really important for providers to revisit some of the assumptions we have about how we talk about early intervention, what we say to families, how we're communicating information. First of all, we always really need to take a stance of appreciative inquiry and focus on the relationship building. The information will come. We will share all sorts of information with families, but it's really important that we understand what they've been told about early intervention, what they've been told to expect from EI, and to get a sense of what they're hoping to get from it. A lot of times we can jump in with saying, all right, we are not a cost prohibitive program. We need your Medicaid information because we're going to bill for that. Or we'd like your private insurance information, but you have the right to decline. We get straight into a lot of the nitty gritty, right, of billing and finances. Or we do a deep dive into our exploratory conversations using our routines-based format or our family assessment format, and we're asking all about their day-to-day activities and these personal routines, and we talk about going into your home. And these may not necessarily be the things that families are ready to hear or want to hear right off the bat. So timing of information is really important. We're not saying don't ever give families the information. We're saying get to know them and ask them what they want to focus on first, because we're going to get all those signatures one way or the other. We're going to make sure they're aware of the process, but timing of information and what we share in what order can really be important for building that trust and building rapport with families. And they've been really clear about that. There are some communities, our tribal communities, who they're not particularly enamored with the idea that you're going to come into their home. Our military families don't necessarily trust that we're not going to share information because the privacy within the military systems has a bit of a questionable, reliability. There seems to be a lot of open sharing of information. And so building trust with people not within that system takes time. And making assumptions about what families will value about early intervention is really important. Like we shouldn't make assumptions that they'll value that something is not going to be cost prohibitive, or that they'll value that we're not going to use traditional clinic-based approaches to work, that we do coaching and embed services and routines. So we have to take the time to build that relationship. And clarity around our roles, particularly if you work for a program that might serve many different families under many different hats. If you're a private therapy clinic that contracts with the state EI program, that's one way you wear that hat. But that same clinician could work for the school system to provide IEP services, or may see families as part of private practice. So understanding the clarity of roles and having a degree of adaptability on how we provide our services while we're building that relationship, understanding what natural environments means beyond the home, thinking about whether or not families have oral traditional cultures, like the Chamorro families in Guam. We're still going to give them the paper, but they want to hear you talk about things. They want to share their story with you in ways that is beyond filling out an intake form or checking boxes on, tell me which routines are important to you and which ones are not. So these are all important lessons that we've learned from families and based on their experiences. For more opportunity to talk about this work, we're really looking forward to the Q&A session. We hope you come and bring your ideas, tell us what you think families most value and why, and ask any questions you have about the broader purpose of our project. Thank you.
Hi, everyone. Welcome to Connecticut's portion of the 2024 Smart Beginnings virtual conference. Today, we'll be going through the cross-collaboration for equity and improved systems in early intervention. So really focusing on how the Office of Early Childhood capitalized on parent feedback and parent voices and bringing parent voices to the table. And we were utilizing the parent cabinet and the ICC to do so. And we'll get into more details in just a moment. But before we do that, we're going to do a quick round of introduction. So I'll pass it to Shanae.
Hello, everyone. My name is Shanae Russell. I am the Program and Family Engagement Specialist here at the Office of Early Childhood, and I, in that role, help oversee our parent cabinet.
Hi, my name is Caitlin McNamara. I'm an OEC Parent Cabinet Representative, and I also sit on the Birthday 3 Interagency Coordinating Council.
Hello, everyone. I'm Elena Trueworthy. It's such a pleasure to be here with you all. I am the Deputy Commissioner for the Office of Early Childhood.
And I'm Nicole Cassette. I'm the Part C Coordinator overseeing the Part C of the Individuals with Disabilities Education Act here in Connecticut. So today we're really going to provide an overview of how the Office of Early Childhood utilized the parent cabinet and the state's early intervention system, which here in Connecticut is Virta 3, to bring parents to the table and infuse parent voice in all of the decision makings that OEC really leans on parents to drive some of the decision making. And with that, how did we integrate some of the parent cabinet work into our Interagency Coordinating Council, or ICC?
And so some of the goals, similar to what Nicole has shared, so you will walk away learning about our development of our parent cabinet, how we brought the lived experience and voices to the table to inform the decisions from systems change into a larger scale around the agency.
Then you'll learn how the parent cabinet is integrated with the Part C systems ICC and how this was a way to recruit families into the ICC.
And as a state, you know, we are always benefiting from the learnings from other states and from you all. And so we hope that you'll also develop ways in which you can bring this model and some of these strategies that we talk about today into your state. So a little bit first about the Connecticut Office of Early Childhood. So I think this really gives a nice framework for what we're going to talk about today. So the Office of Early Childhood is primarily responsible for birth through age 5, although we do work prenatally up through grade 3. We are a state agency that was created back in 2014. And we are the primary agency for early childhood. So we oversee a large network of services and supports and programs for young children and their families. So this includes childcare, our state-funded early care and education system, our quality improvement system, early intervention, which is Virta 3, home visiting, licensing, and our state subsidies CCDF system as well. And part of our philosophy and our work and our vision really centers children and families, right? And working collaboratively and to ensure that families have equitable access, right? They have what they need in order to thrive within our state.
So I will talk about here, we have some wonderful foundation practices and models here in Connecticut that we look to as the Office of Early Childhood when creating our parent cabinet. And I'll highlight two of them. So the first one is the Manifesto for Race Equity and Parent Leadership in Early Childhood Systems. So this framework highlights how parents are a child's first teacher, and when they are engaged as partners and leaders to help improve state systems for young children and families, those children and families thrive and systems improve. Centering equity and creating career pathways is another essential part of this framework. And the second piece is around our Connecticut 2Gen initiative, which is a holistic approach to supporting families. It focuses on the whole family approach to create opportunities and addresses the needs of two generations at once, around also collaboration with others to break down silos and the importance of compensation of parents as experts and empowering parents as leaders and partners in the work.
So we are so fortunate, I think, here in Connecticut because we have a long history of really being leaders and having supports around parent and family leadership and development. And so when the Office of Early Childhood embarked upon the creation of the parent cabinet, we really said to ourselves, what are some of those critical models, right? And strategies that are being used nationally. So in Connecticut, we're so fortunate to have several parent leadership training curriculums and approaches, such as the Parent Leadership Training Institute, and then also the national model of Head Start, which really centers children and families and takes them where they are and moves them along a pathway, ensuring and working on child outcomes as well. So
looking at those frameworks and all of Elena has shared, we use a lot of that in the co-creation of the parent cabinet. So this was started in late 2019 under the support and leadership of our Commissioner Bai here in Connecticut, around recruiting 10 parents and stakeholders from across the state who came from a 2Gen, came from Head Start, and helped develop the concept of what the parent cabinet would look like. And this continued on throughout 2020 through COVID, virtually helping to develop the mission, the structure, responsibilities, utilizing all of that foundational work, and really building those relationships with also those parent leaders and community members in the development and the co-creation process. So it was really a partnership between OEC staff and those leaders. And then all the way through 2021 with the launch of the application and recruitment for parent cabinet member applicants. And those design members who helped with the co-creation were a part of the recruitment. They were on selection committees to help decide the final 15 members that would be a part of the first inaugural parent cabinet, which then launched in September 2021. And through that first phase, the key things that we really focused on were around the relationship building. So still continuing that foundational work around relationship building, and then an orientation to help them in their role, getting them set up and having them understand what the agency is and all of those key things and supporting them. And then all the way through early 2022, where we really had them start up and ensure that they had what they needed technology-wise, and it's gone strong to date.
So what is the CTOEC Parent Cabinet? We are a diverse, parent-led 15-member advisory body to the OEC charged to help advise the OEC to help improve its policies, programs, and services for young families and spread awareness of services for young families across Connecticut. And this was put into statute in the last year. The cabinet members serve a 2.5-year term and represent the 6 CT Department of Children and Family regions in the state. And there are usually 2 members, sometimes 3 from each region, depending on our at-large members. The parent cabinet members help to elevate parent voice from all backgrounds across Connecticut and various needs of children and families. We provide valuable input, insights, and perspectives to the OEC regarding policies, programs, and services related to early childhood. and we increase awareness around OEC services and supports to the community.
So I just want to add that the parent cabinet, Caitlin and the other members have been so instrumental in really helping the OEC hear on a continual basis what are the needs and wants and areas of strength that we can build upon for families, right? And to really help center family voice and help family voice really drive our planning and some of our decision making as well. And that was one of the main reasons why the parent cabinet was established, was because we realized we didn't have enough of those channels to hear that feedback from families on a continuous basis.
I will highlight here that the parent cabinet was put into Connecticut statute in 2023 in our legislative session. So you'll see the Public Act reference there, 23-160. So a very exciting thing for it to be embedded, a part of the agency, as well as have a budget item in our state. So the parent cabinet is a pivotal part of the work. And along with that, though, we go back to the foundation of 2Gen and those others around the compensation piece being so important. So we do feel like that is the best practice and we follow that. So all of our parent cabinet members do receive a stipend for their expertise, for their time. And we partner with a nonprofit organization to help us to process monthly stipends for our cabinet members to get around, because it can be challenging when you're thinking of compensation for parents going through a government system and all of the bureaucracy. So all of our members have bios and a state email on our website, which you'll see the image there on the right. So that way anyone in the state can reach out to see who their member is. And all of the parent cabinet members spend around 4 to 6 hours monthly, so roughly around 68 hours yearly, but many of them do up and beyond. We have monthly virtual meetings. We have subcommittee meetings that happen monthly, as well as quarterly meetings with our local parent ambassadors. And we do local community outreach and advisory group meetings as well. So some members sit on other advisory committees, which we'll talk to a little bit later. And then the key thing is there is this feedback loop to the local parent groups that we've been working to establish and strengthen. And the key thing is just for us parent cabinet members to listen to what's happening on the local level and bring that up to us on the state level when it's key things that we should be aware of for any changes or knowing what's happening on the ground.
Okay, as you can see here, the parent cabinet has had such an amazing impact in many areas of the state. Some of the things I want to share about from my personal experience include getting to present at the NIAC conference in 2022. I got to help oversee some of the language around our kindergarten age change memo. Connecticut recently changed the age of entry into kindergarten needs to be 5 by September 1st, no longer January 1st. So that big change required a lot of information out to parents. So we gave direct feedback on the language and information that parents would need to be most successful in this change, as it's such a big change and happened rather quickly. Then we helped score the home visiting awards this past year. And one of the things I'm really proud of is giving input to some of the birth to 3 staff as my child went through birth to 3 during the pandemic, and being able to give direct feedback about my experience that relates to reopening in-person services that could be utilized so that parents could have the best experience. Okay, so next is my story. So when the parent cabinet application came out, I was very interested in this opportunity because I have always led parents. I never had the opportunity to be the parent leader. So I applied hoping with a child in birth to 3 and having young children to be able to give voice to the parent cabinet with a unique perspective of working in early intervention in my past and still working in early childhood. Also having a young child that went through the program and experiencing it from the parent side. And so my why continues to be that my little one who went through birth to 3, he's overcome a lot of health issues and delays because of those health issues. And birth to 3 really put someone in place to be that point person to coach me through what I needed to do to help him succeed and continue to progress and thrive so that he could develop, especially speech, and communicate his needs. On the parent cabinet, I've had so many wonderful opportunities to be in this collaborative process. When you're on the parent cabinet, it's not just about sitting at the table. It's about knowing the other people who are sitting at the table, understanding the process, and really being able to contribute while you're there, not just observing. So it's been a wonderful opportunity to truly give direct feedback. And this led me right into wanting to be a part of the Birth to 3 Interagency Coordinating Council after being on my subcommittee related to special needs. I got to share my experience at the Family Focus meeting last year. And because of that, I was very inspired to continue to give voice to these agencies' different programs so that they could have the parent perspective. And let's see, so the special needs subcommittee work, our goal is to hear from the experiences of parent cabinet members and those families they hear from whom are impacted by services and programs for young children with special needs and disabilities across the state, and partner with them and their leadership to dive into solutions to increase equity and access and improve these programs and services for families across Connecticut. Some of the examples of the work we've done include the Equity and Family Outcomes meeting for Birth to 3, where we talked more with national support about our family survey. Then we've had a lot of discussions about that transition from Part C to Part B, so Birth to 3 early intervention services into preschool services. And also the Governor's Blue Ribbon panel on childcare, which was an amazing opportunity to get input to affect our system and the things put in place to support children and families.
And that's a nice segue, Caitlin, right into the Birth to 3's mission and vision, which the parent cabinet provided feedback on. And you'll see that on the screen here, but really what it boils down to is Connecticut is a family-focused model for our Part C system or Birth to 3. And we're really focused on empowering families and ensuring that there's equitable opportunities and access for services for families. And we can do this all day at the local level, but we're really not putting our feet to the ground without providing that opportunity for parents to provide feedback at the statewide system and really empowering families to take that next step and ensuring that they are at the table when we're making decisions on our Birth to 3 system. And part of that work is done through the ICC, which I had reached out to Deputy Commissioner Trueworthy and Shanae to really see how we can integrate some of the parent cabinet work into the ICC work. And you'll see here there's 3 outlining priorities of our ICC outside of leading and assisting the lead agency for Part C, but really identifying the sources for fiscal support, financial responsibility, and then also the promotion of interagency agreements, which Caitlin has had a monumental part of, along with the other parent cabinet members who have joined our ICC, and really showing that feedback and showing that reciprocity in terms of how can I inform Birth to 3, but also inform all of this other work that we're providing feedback on as a larger agency, and really aligning priorities. Sometimes there are times where Part C is so regulated that it's hard to get others on board or do that work of interagency agreements, but it really is easy when you bring families to the table who can provide input, and it gets people talking instead of just saying, wow, we're apples and oranges, such as transition, it's apples and oranges, right? Part C and B are different, but when we think about bringing family voice to the table, it gets us thinking differently.
So I think really what we wanted to get across in this slide is that collaboration and true, genuine partnerships are really key to the work. And so when we ask families, when we ask parents, when we ask any stakeholder for feedback, it is like critically important that those loops get closed with those from whom we've asked information, right? We have heard from families, people ask and agencies ask and ask and ask, but I never know what happens to the information that I provide. I never know what happens to the ideas that I'm trying to put on the table and those solutions. And so that is a strategy, right, that we can all do better with, and it is a strategy that we are very intentional about. And I will have to say that Governor Lamont here in Connecticut really pushes state agencies to work across and join forces for effectiveness across state agencies with our services and supports. And so you'll see this as like a micro example of how we do this between the OEC, the Parent Cabinet, and Birch 3 and the ICC.
All right, so we have a few questions that will be helpful for you when you're thinking about doing this work or things to consider. So the first one is, how many decisions do you make in a day that will impact parents? Of those decisions, how many times have you consulted with a parent?
The second being, what are the gaps in your efforts to create family community partnerships and some concrete steps you can make the bridge to those gaps in your program?
Third, what strategies could you use and what are new ones you could take back to implement?
Professional development and workshops and webinars are wonderful, right? But how can you bring what you're learning and take that to action? And so we're asking you to see what can you commit to doing within 30 days from, listening to this webinar. What can you do within your programs, with your families, or within your communities?
So some key points to take away. Our strong parent partnerships are established on a foundation of trust. Parents are lived experienced experts who should be compensated for their time and contributions to our work. Organizations must be ready to partner with parents and value them as lived experience experts. Providing professional development and advancement opportunities is important when engaging with parents. Learning from existing structures and models can be extremely beneficial as opposed to reinventing the wheel. And knowing and understanding the difference between parent engagement and leadership is really crucial to the partnership in the work.
All right, thank you all so much for listening. And we hope that you walked away with learning something and having some next steps. You can reach us by our emails here, and we appreciate all of your attention.
Welcome, everyone. Thank you for joining us today. Today's presentation is on effective practices for engaging multilingual families. My name is Pam Nurse, and I'm the Executive Director for the Federation for Children with Special Needs in Massachusetts. Joining me today will be Susan Oh, our Outreach Manager and Outreach Specialist for the Chinese community, Siriani Liao, who is our School Navigation Manager and has been our Outreach Specialist for the Portuguese community, and Renee Williams, who is our Associate Executive Director. Outreach for multilingual families has been integral to the Federation from its beginning 50 years ago. Today, more than half our staff are multilingual. We focus on the language groups that have the highest representation of school-age children in Massachusetts. This includes Spanish-speaking, Portuguese, Haitian Creole, Chinese, and Vietnamese-speaking populations. We also have staff who speak other languages and whose job descriptions include outreach in those languages, including Khmer and Korean. And to reach other families who speak languages that aren't represented on staff, We use a cultural broker model in which we develop relationships with other individuals and organizations who are from communities that we can't reach with staff. And we rely on our feedback from our cultural brokers on the best culturally appropriate ways to engage families. When we say it's a journey, it's because despite working for 50 years to engage multilingual families and investing tremendous time, staffing, and resources, we know we still have a ways to go to ensure that there is equity among all families in Massachusetts in accessing the resources that are best for their children. We put a tremendous emphasis on a dual capacity family engagement framework, meaning that we work not only to build the capacity of multilingual families to work with professionals, but also the capacity of professionals to work with multilingual families. And to accomplish this, we partner with our state agencies, we advocate for families, we offer trainings for both professionals and families, and for professionals and families together. And all of this is underlaid by the needs of our communities, which are identified by the community members themselves. And Susan Asiriani and Renee will be going into a lot more detail about how we do that. I'm going to turn it over now to Susan O, who will talk about specific strategies that we use to reach families.
Thank you, Pam. Hello from Boston. My name is Susan Oh. I have had the honor working at the Federation for 12 years, starting as a Chinese outreach specialist, now leading a dedicated outreach specialist team. As a parent of children with special needs and a family member of an individual with an intellectual disability, I deeply understand the importance of our work. Today, I will focus on our strategies to reach and support multilingual families. Our cultural broker model goes beyond translated information. We provide tiered supports, including native languages workshop, free telephone consultations, and intensive one-to-one support. Our One Federation language access team ensures we address the needs of multilingual families and professionals. For language we don't staff for, we leverage tools like Language Line and Pocket Talk. To connect with multilingual families where they are, we utilize social media platforms like Facebook, WhatsApp, and WeChat. We have dedicated Spanish and Portuguese Facebook page managed by our outreach specialists. We also collaborate with traditional media like Telemundo and Haitian Creole radio station. To empower families with knowledge, we offer a variety of workshops in multiple languages. This includes our monthly workshop series, Connecting Families, and special education workshops in 5 languages. Additionally, we offer language-specific support groups to provide ongoing assistance and community for families. The language-specific PCTI program equips parents with the tools to navigate special education. We rolled out our first Spanish PCTI in 2019, which helped develop parent leaders who now assist Latino families. Our annual VOC conference held on the first Saturday of March is a highlight. It features language-specific workshops in at least 7 languages, with interpretation available in 8 languages for keynotes. We ensure all conference material are translated and culturally appropriate. Pre-event help multilingual families access the platform smoothly. To bridge the gap between the family and policy makers, we host the Meet the Commissioners pre-conference event. This event provides a platform for parents to learn about new policy and initiative that impact their children. Our goal is to build trust between Federation and multilingual parents. Now, let me pass it on to my colleague, Asiani.
Thank you, Susan, and hello, everyone. Imagine transforming your school experience for multilingual families, making them feel welcome and supported from day one. Today, we will explore how to enhance language access and deepen family engagement. Developed through our ongoing work with our Department of Education, DESE, the School Finder program, a multilingual phone service that helps families of children with or without disabilities navigate the educational system by overcoming language, technology, and cultural barriers. We meet families where they are by assisting them in navigating the educational system and finding placement that meet their children's specific needs. The School Finder project emerged from a year-long effort to understand the experiences of language diverse families in navigating educational options, particularly in career and technical education. The Secondary Options Family Engagement, SOFI, project conducted during the 21-22 school year with DESE funding aimed to build awareness of this educational path. The project involved gathering insights from families to improve messaging, increase awareness, and enhance the Massachusetts School Finder tool. FCSN specialists collaborate with cultural brokers to reach specific language groups and communities. We have the introduction to Massachusetts schools, recorded in multiple languages, providing basic information of what to expect if families are new to this country or to the school system. As part of our collaboration with DESE and to ensure the interpretation services provided by its school districts meet the needs of our multilingual families, we have participated in training courses to better understand how interpreters are trained to support EL students and their families. DESE offered to all districts across the state this new interpreter training program, which is divided into 3 tiers. The tier 1, also called language ambassadors, the bilingual staff is trained to assist it with the basic school-related communication. The tier 2, intermediate, staff who support more complex interactions without legal content, such as parent-teacher conferences. The tier 3, advanced, professional interpreters trained to handle legal and special education meetings with the cultural sensitivity. Please keep in mind that not all bilingual individuals can provide interpretation services effectively, at least not without training. A successful interaction should make you forget that you and the family are speaking two different languages. Engaging multilingual families goes beyond language services. It's about trust, respect, and a sense of belonging. By understanding and addressing their unique needs, we create a supportive environment where everyone can thrive. Now, I will hand it over to Renee Williams, who will discuss our specific procedures for providing accurate and effective translation and interpretation services in our events.
Thank you, Sarianne. We'll take a few minutes now to discuss some of the systems and process we use to incorporate translation and interpretation into the trainings and other supports we provide. When looking at translation and interpretation, identifying the specific needs of language-diverse families is critical. At FCSN, we accomplish this through needs assessments, focus groups, guidance from our outreach specialists, and/or collaboration with cultural brokers. This ensures information is culturally sensitive and contextually appropriate. Translated materials, whether produced by tools like DeepL, Microsoft or Google Translate, and even by translation services, undergo meticulous review by outreach specialists. This multi-layered approach ensures that communication is clear, relevant, and accurate. We provide language interpretation using live interpreters and/or AI service. Considerations when working with interpreters include the ability to provide a more personal approach, cost. This typically is based on an identified hourly rate. Multiple interpreters are needed for each language when presentations are over an hour. Interpreters likely require materials at least 2 weeks in advance. And Zoom easily accommodates setting up interpreters into language channels. For over a year, FCSN has also offered Wordly, which is an AI-powered interpretation platform. It interprets in 60+ languages, integrates easily with Zoom, and is easy to set up, provides audio and transcriptions in each supported language. Unlike Zoom interpretation channels, Wordly does provide the ability to pull reports and see how many attendees access each language. You can purchase packages of hours and are billed by actual minutes used. It should be noted that Haitian Creole currently is not yet supported. Preparation is key. Our preparation and support includes providing advanced instructions to presenters, such as to speak at a slower pace, spell out and explain acronyms, and provide materials in advance. Offer clear instructions for attendees in advance of the webinar and in confirmation notices. Outreach specialists provide dedicated training opportunities to support parents and always solicit feedback from attendees. Determining which type of interpretation and when to use it is based on community needs upon request or the type of event. We always interpret our signature Visions of Community Conference, our monthly Connecting Family series, and our SPP APR indicator sessions. This was just a brief summary. Feel free to contact us with any questions. Thank you.
Good afternoon. I am Alicia Walters, and I work at the U.S. Department of Education, Office of Special Education Programs, OSEP, in the Monitoring and State Improvement Planning Division. Thank you for joining us for Day 2 of Smart Beginnings, Early Beginnings to Bright Futures. We want to thank our presenters from DAISY, the Center for Parent Information and Resources, WestEd, Connecticut, and Federation for Children with Special Needs. As our presentation ran a little long today, we're going to extend our FAQ sessions until 3:45. I will now ask our excellent presenters to join me on screen. Okay, we have a few questions that have come in. Please go ahead and put your questions in the chat. One of the questions we had for the Connecticut team is, can you share about how the cabinet supports families transitioning out of birth to 3 services?
Hello, everyone. Shanae Russell from Connecticut. So this is something that has come up in our Children with Special Needs Subcommittee that we have a few parent cabinet members on, as well as some OAC staff. And it's something that we are currently still trying to figure out some solutions, but trying to utilize our feedback loop that we have with our ICC and our early intervention, which is Birth to 3 here, to try to tackle. But a huge part of that has been around elevating around access in our governor's Blue Ribbon on Panel childcare report, and trying to have that rate be raised up. So it's something that we're still working on and still tackling.
Thank you. The next question is Wordly a free use AI service, or does it require a paid subscription?
Excuse me, I'm Pam from the Federation. It is a paid service where we pay only for what we use. So we, don't maintain like a monthly rate. If we don't use it, we only pay for what we use.
Thank you, Pam. The next question is what method of contact was successful for reaching out to the governor to get them on board with hearing parent voices more frequently?
Yes, hello. So I typed in the chat, but OEC does work very closely with the governor's office, and through the creation of our Blue Ribbon panel on childcare, which there was a panel of different stakeholders that were charged with developing recommendations for our 5-year strategic plan. And we ensured that we had a parent cabinet member on that panel, as well as having parent cabinet members give input into listening sessions around some of the struggles that parents were facing, and making sure that those were present in those recommendations. And as well as we had parent cabinet members speak at a few different events around the listening sessions and around the whole Blue Ribbon panel on childcare that the governor was present at and was able to hear directly from the parents, their experiences. And we frequently ensure that a lot of the work parent cabinet is doing, we are sharing that with the governor and the governor's office, so they're aware of the work that is being done with OEC.
Thank you. The next question, I'd have Leslie share her response. Are there any supports that can connect disadvantaged families with resources to secure access? The writer's concern is that families may be unreachable due to the lack of stable access to phones and technology in disadvantaged and rural areas, so the children may not receive the services they require.
Thank you, Alicia. It's a great question, and I'm from a rural community, so I have great appreciation for it, and was a direct service provider for many years. So I think it gets into when we're talking with referring providers. So as much information as they can get from the family about how best to reach the family is helpful, and including that in the referral. But I think it's also really important that referring providers are explaining to parents that they're going to make a referral. And that's something we've learned through our project, is a lot of times physicians in particular aren't necessarily telling families in advance that they're going to make a referral, why they're making a referral, or what the families can expect. So the only information they may have may be a billing address, right? Or a phone number. And as we know, phone numbers come and go. You have temporary phones, you have SIM cards that expire. There are lots of things. So really having that conversation with families about the referral process and asking them, what are backup numbers? Or would you like someone to drive out to your house? Would you feel comfortable with someone driving out to your house unannounced? Would you like to be notified via letter? Is there a community organization? Like, do you regularly attend church or synagogue where you would like to meet the EI provider there and talk about early intervention services and options that they might want to pursue? I think it's really important that those conversations that the referring provider are having with families include more than how can we reach you? And it's really about how do you want to be reached and where and under what circumstances are best fit. Because you're right, when your transportation is a huge issue and technology is a huge issue. So we can't rely on cell phone service, and we can't rely on email as a way to for the EI program to access families and make those connections. And there are restrictions on how we can use text messaging without parent permission. So, so it's really important that that providers understand that they need to be having these thoughtful conversations with families. And when they're asking, how do you want to be reached or how it's best to reach you, that they're getting alternatives that can be pursued that the family is comfortable with.
Thank you, Leslie. I would now invite the participant, if there's any further questions, please go ahead and put them in the chat. This is just a comment that I'll share. Connecting with families, never assume that because we all use the internet, all families will have the same access to internet. This means that one will need to be flexible about how to make those connections possible. There is a lot of pressure now, for example, in New York State, from providers of EI services to continue providing services via telehealth, and this, unfortunately, doesn't work for all. Plus is a parent choice how services will be provided, natural environment. Okay. Thank you for sharing that with us. Okay. Our next question. As a referring provider or agency is found, including the family's childcare provider, is often beneficial. This provides a support system for the parent and gives us a meeting place. And I think this writer was referencing Leslie's comment about the rural community. There are no further questions in the chat. One moment. Okay, no further comments in the chat. And so what we're going to do is, I wanted to thank all of our wonderful and excellent presenters for today. We gathered a lot of information. On behalf of OSEP and all of our presenters, thank you again for joining us today. OSEP is committed to ensuring that you have the resources, knowledge, and partnerships needed to help your child thrive. If you have additional questions for our presenters, please enter your questions into the chat. We will communicate answers to any additional questions through email outreach. Following the conclusion of Smart Beginnings 3-day conference, you will be able to access recordings from this year's event and access Smart Beginnings presentations from previous years at the Ideas That Work website. We will send all participants a link to the recordings and the slides once they become available. As we close today's virtual conference, I want to remind all participants that you can earn continuing education units for participating in this year's conference. At the conclusion of the 3-day event, which is this Thursday, an email will be sent to all participants with instructions on how to apply for the CEUs. In closing, please accept our sincerest appreciation for your shared commitment to the high-quality education and support of our infants, toddlers, children, and youth with disabilities and their families. Thank you again, and we hope to see you tomorrow. Have a great afternoon.